Hi everyone, welcome to this session pertaining to menopause. I'm Dr. Richa Saxena, an obstetrician gynecologist by profession, author of more than a dozen books in obstetrics and gynecology for both undergraduates as well as postgraduates. Recently, I've started an initiative, Let's Talk Women's Health, which is based on the concept of 4 E's. That is basically enlightening and empowering women through education and e-consultation. So as part of this initiative, keep having webinars and educational sessions for women, patients in particular. And in case anybody is interested for an e-consultation, they can visit my website www.drrichasaxena.com and I'll be happy to assist you with the consultation. So coming back to the topic, menopause, which is an unavoidable phase of every woman's life. It is an important aspect of every woman's life. So what exactly is menopause? Menopause, in simple words, it basically refers to cessation of periods, and this is basically because of the cessation of the follicular activity or cessation of ovulation, which causes the periods to stop. So medically, when the woman stops having periods for last 12 months, it is termed as menopause. So now coming to the age of menopause. Menopause usually occurs between the age group 45 to 55 years, and the average age at which menopause occurs is 51 years. In India, the age of menopause is slightly lower, so it tends to occur in slightly younger women. So it is usually 42 to 49 years is the age group in which in India the menopause occurs. And if menopause occurs below the age of 40 years, that is known as the premature menopause. Premature menopause can occur due to several causes, the most common being genetic predisposition or chromosomal abnormalities, typically what is known as Turner syndrome. So these are common causes of premature menopause. So coming back to menopause, so what exactly happens? Why does menopause occur? Menopause basically occurs because the ovarian follicles, they get depleted. So every woman when she is born, she would be having a reservoir of ovarian follicles in her ovaries. And as she grows old, like when she's newborn and when she reaches her adolescence and then she grows older further, this reservoir, it keeps depleting or it keeps diminishing in size. Once the entire ovarian reservoir has depleted, that phase is known as, that is the time when she will attain menopause. There are hormonal changes which are also occurring during menopause. And the most important hormonal changes which are occurring is that there is a reduction in the level of estrogen, or what is the female hormone. So the most important female hormone in the body of every female is estrogen, and the levels of estrogen, they decrease, and when estrogen level decreases, there is an increase in the level of FSH, or the follicle stimulating hormone. So basically the two hormonal changes which are taking place in every woman's body during menopause is that estrogen levels, they decline, they become very, very low, and FSH level, or the follicle stimulating hormone levels, they become very, very high. Now besides menopause, few years before menopause is the time which is known as climacteric or the perimenopause, and majority of women, they start experiencing symptoms resembling menopause during this phase. So the periods become irregular and they may experience some symptoms related to menopause during this phase, because drastic hormonal changes are taking place during this phase. So now let's talk about the symptoms of menopause. So the first and the most important symptom is the cessation of periods. That is, you will stop getting your periods, which is the most important symptom of menopause. Then besides that, very common symptoms are the vasomotor symptoms. So what is the vasomotor symptom? Vasomotor symptom basically means that the thermostat mechanism in the body, gets altered because of the hormonal changes, and because of the temperature regulation is affected, the women may experience some symptoms. So the most important vasomotor symptom which you can experience is the hot flashes. And in hot flashes, what happens is there will be a sudden sensation of warmth, and suddenly she'll start feeling very, very hot and she may sweat. And this sensation of warmth is typically felt on the face, neck, and the chest. And after a few seconds or few minutes, it may pass off. Besides that, they can be sweating in the night, and this may also result in sleep disturbances. Besides the vasomotor symptom, other common symptoms include the cognitive problems which the woman encounters during menopause. So, what are the cognitive changes which may occur during menopause? Cognitive changes are those changes which may affect the functioning of the brain. So, they may be memory loss, they may be lack of concentration, they might be tiredness, they might be symptoms, psychological symptoms like mood swings, there may be anxiety, irritability, depression, etc. Besides the cognitive symptoms, other symptoms which can occur are the urogenital symptoms. So, what are the urogenital symptoms? Basically, the urogenital symptoms, they include the sexual symptoms, that is, she may have pain during intercourse, and this is medically termed as dyspareunia. And this is basically because vagina loses its smoothness, and there is vaginal atrophy which is occurring, and this is because of lack of estrogen. So there may be dyspareunia, there may be also reduced libido. Libido basically refers to interest in sexual activity, and this interest in sexual activity gets greatly diminished as a result of menopausal changes. Besides that, there might be certain urinary symptoms. This typically includes dysuria. So dysuria typically means pain while passing urine. They may also be recurrent urinary tract infections. They can be incontinence, which can occur in women, which could be related to coughing, or it could be related to lifting heavy weights or just sneezing, etc. It may result in incontinence. This is known as stress incontinence. Again, this is an important symptom associated with menopause. Some women may also experience genital prolapse. Genital prolapse is basically protrusion of the organs. For example, uterus may protrude out of vaginal introitus. This is again typically related to menopause. Besides this, there can be other symptoms which may include drying of skin. The skin becomes rough and dry. There may be thinning of hair which can occur. Bones become brittle and fragile, and this is very important because women become prone to develop fracture because of the thinning of bones. And fractures typically may involve the hip, they may involve the spine, they may also involve this region, the wrist region. These are the three regions where fractures commonly occur in menopausal women, and this may be typically associated with a lot of morbidity and mortality in the women because the treatment of fractures may be surgical, and this may further result in several complications in these women. So, avoidance of fracture and taking care of the bones, it becomes an important aspect of menopausal care. Besides that, there may be sometimes she may feel dementia, that is loss of memory. So coming to management of menopausal symptoms. So one may say that yes, there is a deficiency of hormones which is occurring in the body. So the best thing would be to prescribe hormonal tablets containing estrogen and progesterone. And this is what was typically the idea behind hormone replacement therapy. I think 2-3 decades prior, HRT was introduced with a lot of show and pomp because it was felt that HRT would take care of all the symptoms related to menopause. So the prescriptions comprising of combined estrogen and progesterone tablets was commonly given to women. But over the years, studies took place and it was realized that HRT is not that useful and it may be associated with its own complications. And typically, it can be associated with complications such as heart attack, venous thromboembolism. Venous thromboembolism basically refers to development of clots inside the blood vessels. There might be increased predisposition to cancer of breast, cancer of womb or cancer uterus. They may be also increased predisposition to develop dementia. So because of all these complications, the prescription of HRT is largely limited to those cases which are experiencing severe symptoms. So, if a woman is experiencing severe symptoms, only in those cases we try to prescribe HRT, and that too we give HRT in as low dose as possible and as less duration of time as possible. So, if you are experiencing menopausal symptom, what should you do? So, what I would suggest is the first thing which you should think about is lifestyle changes. Lifestyle changes will not result in any kind of side effects. So that is the first thing you should resort to. And lifestyle changes, the first thing which includes is the diet. So in the diet, what you need to incorporate is eating right. So eating right, what does it comprise of? Food which is rich in calcium and vitamin D, because this is particularly important for increasing the strength of your bones. So food rich in calcium and vitamin D includes milk, egg, fish like salmon, oranges, avocados, broccoli. These are foods which are rich in calcium and vitamin D. Besides that, you must also increase the intake of vitamin E and vitamin C. And increased intake of vitamin E and C is basically important for giving a glow to your skin and preventing it from getting rough, and it'll keep your skin smooth. Besides that, avoid spicy food, avoid alcohol, avoid smoking. And this is important because avoiding spicy food will also help in reducing the occurrence of hot flashes. Then there is another important, very important food component which I would like to tell you about. But all the women, especially if they are vegetarian, they should resort to, and this is soya bean. So soya bean in any form. And why soya bean? Because soya bean contains phytoestrogens. Phytoestrogen basically means plant estrogens. So plant-based estrogens or natural estrogens, they will not be associated with any side effects, and this has also been approved by the FDA or the Food and Drug Administration. So I would recommend that you do take phytoestrogens or soya bean. And soya bean can be taken in any form. It could be taken in form of soya milk, it could be taken in form of whole soya bean grains, or it could be taken in form of soya sauce or soya chunks. So we were talking about phytoestrogens. To talk further in details about phytoestrogens, there are several herbal formulations which are available, and they contain phytoestrogens, and I recommend women to take these phytoestrogens over HRT because they are quite natural and they will not be associated with any kind of side effects. So some of the natural estrogen formulations or the herbs which contain these naturally occurring estrogens, they include red clover, black cohosh, ginseng, evening primrose, kava. These are the things. If you take medications containing these herbs, then this is useful. And I usually like to prescribe these kind of medications which will not expose you to any kind of chemical hormonal preparations. So besides the food stuff which you should include in your lifestyle changes, which you need to do another important thing which you need to do is exercising. Exercising need not be hitting the gym necessarily. It basically means having an active lifestyle. So it could be in form of swimming, cycling, normal walking also every morning and evening. It could be a neighborhood park which you can use for walking. That is sufficient to take care of your, exercise. Yoga, meditation again is important because this will also help take care of the stress levels. Besides these things, what is important is annual health checkup. So annual health checkup becomes very important during this period, and especially screening for cancers, because cancers which are typically very common during this period, or the gynecological cancers, which are common during this period. They basically include the cervical cancer, the endometrial cancer, the breast cancer, or getting a pap smear to detect cancer cervix in the early stages, or a mammography to detect breast cancer in the early stages becomes important. Another important thing which you need to take care about during this phase is to keep your blood pressure in control. Again, because an important thing is that estrogen is a cardioprotective hormone, so it protects your heart, and that is the reason why women, they have less incidence of heart attack or heart related problems in comparison to men. However, once women attain menopause, then the protective effect of estrogen gets lost, because estrogen levels, they become very low. So women at that point of time in the menopausal stage, they become equally prone to develop heart disease or heart attack in comparison to men. So you need to take care of your diet, reduce the levels of cholesterol in it, take control of your blood pressure, again adopt an active lifestyle to bring your weight in control and to control your stress levels. So, with this, I would like to end this session, and thank you so much for listening to me. And in case anybody is interested in getting any consultation from me, then you can visit my website www.drrichasaxena.com. So, thank you so much for being here.